Well, welcome to a very unusual edition of Beverages with Brad from my kitchen with my guest, Karina Santos. Karina, thanks for doing the show.
No problem. Thank you for having me.
Thank you for doing what you do. I do not have the bravery, the courage, or the strength to do a job like yours, so I really appreciate it.
Thank you for saying that. I appreciate it. They didn't tell us about that in nursing school.
But they didn't. Oh, they didn't say that a global pandemic was coming.
Well, they talked about it, but it was in a distant, like hypothetical utopian type thing. It was never like, yeah, you're gonna put your life on the line when you graduate type of thing.
They didn't like show you a few seasons of The Walking Dead to get you ready.
No, nothing like that. They showed us slides from like the pandemic of 1918, but we never in our lifetime thought we would actually do anything like that.
Why don't we start by telling us your job title and describe your job a little bit.
Sure. So I've actually had a few job titles. I'm mostly a staff nurse. I've spent most of my career in critical care. So right now I split my time between the trauma intensive care unit and also the peri-anesthesia care unit. So I take care mostly of surgical patients, a lot of trauma patients. And then I'm also a part-time student.
Wow. All right. So you're busy. So thanks again for taking the time to do a ridiculous YouTube show. So it sounds to me like you deal with like the heaviest of situations and like the most serious of patients. Is that the best way to describe it?
I would say, yeah. I'm lucky enough that my career at least has prepared me a little bit to expect the unexpected, especially in trauma. So not a lot of nurses have that experience. But like I said, nothing can really prepare you for this type of thing. And we've always had enough backup. I've always felt safe in my job that I can do my job and do it safely. I've never really felt like I'm in danger like
Right.
I am now.
What was it like when it first started coming up? What was your reaction and what was your feeling?
So we've actually been in the hospital kind of hearing about it since January. I probably had heard about it when it first started in China. And we kind of knew already from our rigorous flu seasons and previous flu seasons that we probably were not equipped to handle a mass influx of patients. And even this past summer, when we've had traumas come in where we've had multiple casualties, we did it and we did fine. I feel like we succeeded in doing what we needed to do and take care of patients, but at the same time, it was kind of chaos. So I knew, and that was only, 6 or 7 critically injured patients in our trauma service. So, and that was kind of chaos. So you can imagine, I was like, if we have 100 patients or 200 patients come in critically ill, we are not equipped for any of that at all.
Do you guys have everything you need now as far as equipment, space, all that, staff?
I think as far as Rhode Island, we've been really lucky. I think regardless of how you feel about politics, I think we have to give kind of credit where credit is due, that our governor and the Department of Health have kind of done a good job with mitigating everything, closing things down as hard as it is. We've had nurses that have been kind of reduced hours because we've stopped certain surgeries, we've closed, ambulatory centers, but it needed to be done. And the problem is that right now we do have everything that we need. The problem is when that surge hits, like I said, if we get 50, 60 patients all at once who all need to be intubated or all need critical medicines, we will likely run out and we will more likely not have enough to go around. So that's what we're trying to keep that from happening.
It's been so strange, like as an outside observer, because if I put on like CNN, I think the whole world's ending. We're all gonna die, and there's no hope, and it's all Donald Trump's fault. He like created Corona in a squirt gun and shot it at everybody. But if I put on Fox News, it's like everything's great. Let's open the economy. Trump saved the world. It's like it's so hard to know. Like, okay, how you know what I mean? How optimistic or pessimistic or whatever, like what the hell is actually going on? So it makes sense to me what you're saying as far as you guys are doing okay. But the concern is if we open the economy, all of a sudden you might get flooded. Is that what
Yeah,
you're saying?
I mean that's exactly what happened in New York. From what I look at it, that they started probably a little too late, and also their population is a little different from ours, and they're very concentrated, especially in New York City. But I think that's exactly what happened, that they weren't prepared and they didn't have enough time to prepare, and they literally got hundreds of patients all at once, and we don't have the capacity for that. I don't think anybody would have the capacity to take 200, 300 patients all at once that are all critically ill.
Like, when do you think that the economy should be reopened?
Um, I think nurses are probably the not the greatest people to make that decision because we tend to err on the side of caution. Um, and I get that the economy is everything kind of plays together. Economy is very, very much tied to public health. In scenarios of poverty, there is more increased um, health disparities. There's more issues, people can't afford their medicine, so they get sicker. So there's more issues in poverty. So you definitely don't want the economy to be halted for this long or longer, but you also don't want to overflow the hospital either. I mean, we have nurses that have been dealing with this um, almost every day for the past month. They've been dealing since the first patient became sick. Those nurses are going to be very tired. They're going to need a break, and we still have another couple months of this. I think it's going to be like a slow progression, and we just have to be ready to like knuckle down and kind of help out and not overwhelm the system. I think once we can get everything under control with testing and we know who to isolate, who not to isolate, and people follow the rules and don't go to work sick, keep hand hygiene and all the stuff that we're doing now, is going to become like a way of life for maybe the next year or so, in my opinion.
Do you think it's going to be like a year before the vaccine? Because that's what I hear, like 12 months or something.
I mean, it depends. If they try to push it, if they try to push it maybe under a year, that's like a miracle. If they rush it, I would hate for them to rush it and have a lot of people have complications from the vaccine.
Are you guys using any of the drugs that I hear about? Like this, I'm going to say it wrong, like this hydroxychloroquine. Are you guys using stuff like that?
The trade name for that is Plaquenil. So that's used for rheumatoid arthritis. I don't know that they've actually trialed it. I think we work together with the health department, and they have to meet certain criteria to be able to go on a what they call off-label use of the drug.
Like experimental drugs?
It's not considered experimental because it's already established as safe.
Right.
The reason they say that it's an experimental is because for them to see some effects, you have to use like triple or quadruple the dose that people take it for other things. And at those levels, if you asked any other doctor, they would say that's not a safe level to give it as. But the CDC and the Department of Health have okayed it with certain patients. They can receive a higher dose to see if it helps.
It's kind of like a desperation move.
Yeah, and like I said, they have to meet certain criteria. We do the risk versus benefit. All the side effects with that medication that you can get at a normal dose are doubled, tripled, quadrupled with the dose.
One of my friends just texted me and said, "Don't ask her if we're all going to die." I was like, thanks. Like, I realize that I can be like a bit of a jackass, but I don't think I'm that bad. I tend to be negative sometimes, and obviously
I am too. I'm trained that way. That's why I said nurses aren't really the ones to ask about reopening things, because we're always preparing for the worst. Like, I'm always prepared for breaking a leg, for bleeding to death. I'm not the one to be like, oh, it'll be all right. Like, no, I have a tourniquet in my car for, when I find somebody with a bleeding leg.
But you have the right. See, I feel like you have the right to be pessimistic in your line of work. Like, I'm a comedian and a karaoke host. Although, I mean, if you've heard some people sing karaoke, it's pretty bad.
Yeah, I do a terrible job.
Like, tell me something. If there's anything that maybe, the rest of us just have no clue.
It's not really their fault. Infection control. The people out there wearing gloves, cut it out. Don't wear gloves because they're cross-contaminating. When you're wearing gloves, you're not washing your hands.
Right.
And all you're doing is keeping your hand, what you think clean. You think your hand is clean and you're keeping it clean from anything else, but you're not protecting anything else. So you're touching, thing A with your gloved hand, and then you're touching thing B and C and D. All of this isn't contaminated. So you think your hands are clean, but then you're also grabbing your phone, you're grabbing the shopping cart. And then when you take those gloves off, you think your hands are clean, and then you're touching your phone again. I don't wear gloves that often in the hospital even. What we do is wash our hands. We only use gloves when we know that there is a bodily fluid that can't be controlled. So if I know if there's urine, if there's feces, if there's blood, if I know that, then I wear gloves. I don't wear gloves all day, every day in the hospital.
So if you're watching this at home and you're wondering if you should wear gloves, ask yourself, do I plan on handling feces today? If not, you shouldn't wear gloves. You should wash your hands. Is that what you're saying?
Yeah, because you're clearly not washing your hands if you're wearing gloves.
Right. I remember my mom, like, really, as a kid, teaching me, like, the importance of, like, washing my hands. And I was like, yeah, Mom, I get it. And then here we are a million years later, and it's, like, the most important thing on the planet. So shout out to my mom on that one. What's the story with the masks?
The masks are not ideal. The masks are really to protect others. They're not protecting you. Mm-hmm. The only mask that'll really protect you, and again, we don't recommend that you wear a mask like this, are the N95s. And again, they have to be properly used and properly tested. It's not comfortable. It's not something you want to wear all day. I don't even want to wear it for an hour. I saw some dudes riding down Eddy Street on ATVs, full go, but they had N95s on.
So you're like, so was that a good thing? Where you're like, oh, at least they're wearing N95s? Or were you like, this is stupid?
I guess, but I wish people would stop doing that, because you're more at risk from an accident. Because again, you'll be a trauma and you'll be on my unit.
And you don't want to deal with these ATVs.
You're more at risk. Yeah, you're more at risk. I mean, you're protecting your. I don't know what they thought they were protected with the N95, but if they crash and they come into the hospital, they're more at risk of contracting the virus in the hospital than out.
Is it a misconception that this is just really hitting older people and people with pre-existing conditions? How accurate is that statement? Or, I mean, I know obviously there's some exceptions to the rule. Is there a lot of exceptions to the rule?
I don't think so. Unfortunately, there's a lot we don't know about the immune system, and it seems like this is an immune-driven thing. So, like I said, it's like a 23-year-old that all of a sudden can't walk or can't breathe because they got ALS all of a sudden. Mm-hmm. It's like a glitch in your immune system. So most likely, if you already know that you have a problem, some kind of health problem, you're more apt to get the flu. You're more apt to get any other type of infection. So you're more vulnerable to this virus. But then there's also the, small percentage of the population that'll randomly get Guillain-Barré from the flu shot. Those are the people that will probably be the 23, 25-year-old that will get the coronavirus and will end up in the ICU. But we don't really know why it affected them that way.
Maybe some kind of silver lining, like maybe something you learned about yourself, about your coworkers, about, I don't know, society, Rhode Island, whatever. Have you found any things like that? Any life lessons you've taken out of this? Or is this just one big pain in the ass?
Yeah. Unfortunately, in my line of work, I see that every day. My colleagues are very inspiring. I've seen a lot of people step up. There are nurses that have been out of the ICU that I work with in the PACU, the peri-anesthesia unit, that have been out of the ICU for 10 years, 15 years. They're close to retirement. They're stepping up and saying, I'll take care of critically sick vented patients. They left that life a long time ago. They were ready to retire in the next couple of years. They're stepping up and saying, I'll go help. Because they know that if they don't help, we don't have enough nurses. And I will most likely be drowning in a couple of weeks in ICU patients. But if my colleagues step up and they come out of close to retirement and are willing to help me, then I don't have to take on that load. That's really, it's inspiring to me. And I feel like it's a little bit of silver lining that we're seeing people, how generous they are. I've been making masks for the homeless population in Rhode Island also. And a lot of people have given me donations, given me money, given me masks.
Wow.
It's really nice to see that people can, even in their own mess of whatever you're going through, whether, you can't pay your mortgage this month or whatever, people are still willing to think of others and help.
When this pandemic ends, are you going to go on vacation? And if so, where would you go?
Not a cruise.
Yeah, I've always been horrified of cruises. Horrified of them. The ocean horrifies me. Being all condensed with all these strangers in flip-flops when they're disgusting feet. That's always not been appealing to me. I never wanted to go on a cruise. And my wife would say, oh, maybe we should go on a cruise. Like, no, I don't want. And now that this is happening, I'm like, see, cruises are terrible.
Most likely take a vacation to see my family. I have family that still lives in Guatemala, so I would most likely go visit.
Well, I hope that happens for you. I hope you can go on that vacation sooner than later. So thank you so much for doing the interview, for being on a very unusual episode of Beverages with Brad, but a meaningful one anyways.
No problem.
It was great talking to you.
Absolutely. Thank you.